Hello everyone, I am Tasmia Islam and today I will be presenting our project OncoTrack, a Terahertz metamaterial biosensor for detecting cancer stages. In many underserved and remote communities, cancer testing is not easy. Diagnostic centers are far away, and appointments take a long time. Patients often need several visits just to get results. By the time the result finally arrives, valuable time has already been lost, not because treatment does not exist, but because access is limited. But this is not just one person's story. This is the reality of millions of people living in underserved and remote areas. And this brings us to an unavoidable truth. Cancer is a race against time. Every year, more than 10 million people die, often not because treatment doesn't exist, but because the disease is found too late. For cervical cancer, survival drops sharply as the disease advances. In the US, 5 years survival falls from 93% in stage 1 to just 15% in stage 4. In rural India, it drops from 78% to only 9%. This clearly shows how early detection can save lives. If early detection works so well, why does it fail so many people? The graph highlights the extreme global disparity in cancer screening uptake across countries and cancer types, based on data from the WHO Can Screen 5 project. Mammography coverage ranges from 1.7% Bangladesh to 85.5% in the UK. Cervical screening from 2.1% in Cote d'Ivoire to 86.3% in Sweden, and colorectal screening from 0.6% in Hungary to 64.5% in Netherlands. These wide ranges show that access to cancer screening is highly uneven, not only between high and low income countries, but also across different cancer types. It is driven not only by lack of technology, but by systemic barriers. As current diagnosis is available but remain invasive, expensive, slow, and often inaccessible. To understand the impact of these challenges more clearly, let's explore this limitation in detail on the next slide. Traditional cancer screening depend on invasive and expensive biopsy that take a long time to deliver results. These barriers reduce access, especially for people in remote areas, and delay early detection. This slide shows that the real diagnostic journey highlights the time and cost involved in the current system. First, consultation, then imaging, biopsy, pathology, reporting. Each steps add delay, a step add cost. On average, imaging appointment takes 1 to 2 weeks, biopsy 3 to 7 days, and pathology processing 7 to 14 days, resulting in a total turnaround of 2 to 6 weeks for a confirmation diagnosis. Financially, each complete diagnostic episode can cost between $3,000 to $7,000, including imaging, biopsy, laboratory test, and consultation. Clearly, this process is both time consuming and expensive. To tackle the critical gap in current cancer diagnosis, we have designed a terahertz metamaterial biosensor, which is capable of detecting cancer of different stage with high sensitivity and real time. We combined a split ring resonator and a nested square ring resonator. The split ring resonator acts as a bright moon and strongly excited by the terahertz wave, while the nested square ring resonator is a dark mode, minimizing radiation loss. Their interaction produces a yet-like resonance with a sharp transparency peak. Changes in tissue's dielectric property caused by cancer shift, this resonance frequency allow us to detect cancer precisely. Our goal was clear: make cancer screening first, affordable, and safe for regular use. Our terahertz metamaterial biosensor achieves this by detecting stage-wide cancer changes through precise electromagnetic structures. It is non-destructive, level-free, and polarization insensitive, and delivering stable results in under 1 hour at a cost of just $10 to $50 per test. This system is designed for people who are currently left behind. The woman in a remote village who cannot travel for biopsy, the clinician in a district hospital, the health system that cannot bear thousands of dollars per patient, high-risk individual needing frequent and safe monitoring. In fact, everyone who deserves the early diagnosis. This research used finite element method in CST to simulate the sensor, applying Maxwell equation and the Drude model to accurately analyze electromagnetic behavior. Different stages of healthy and cancer cell are modeled, and transmission results are used to observe resonance frequency shift and compare performance. Healthy tissue resonates near 1.40 terahertz. As cancer progresses from stage 1 to 4, resonance shift progressively lower. Each stage produces a distinct, non-overlapping frequency shift and allowing clear differentiation between stages. Q factor decreases as tissue becomes more lossy with cancer progression, but the resonance remains sharp and measurable. Here is a demonstration of how our sensor responds as biological properties change from healthy tissue to advanced cancer stage. When we click Start Simulation, the CST solver solves Maxwell equation for the Terahertz metamaterial absorber. The red and a light represent biological cells. First, we assign healthy cells properties, then modify conductivity, permittivity, and density for stage 1 to stage 4 cancer. After each simulation, the absorption curve is calculated from each parameter and plotted. 5 graphs are obtained for healthy and 4 cancer stages. Results show a progressive rate shift in resonance frequency and changes in absorption magnitude, confirming the sensor distinguishes cancer progression. Our solution is not only effective but also environmentally responsible. It uses non-ionizing terahertz radiation, generating no harmful or radioactive waste. This system requires no reagents, dyes, or disposable materials and operates with low energy consumption. Because the sensor is reusable and non-invasive, it avoids surgical, chemical, and pathological waste which is associated with conventional diagnosis. Early cancer detection, and it is an approach comes without an environmental burden. We have a clear realistic plan. Prototype fabrication and terahertz testing between 6 to 12 months, microfluid integration between 12 to 18 months, machine learning based classification between 18 to 24 months, clinical trials between 24 to 36 months, and commercial deployment thereafter. And this is the pathway from simulation to real world impact. So far, we have designed a high Q factor EIT-like Terahertz biosensor, demonstrated stage-wise cancer detection, achieved polarization in sensitive performance, established a scalable and affordable roadmap. So here are some limitations of our current terahertz sensor. Firstly, our current results are limited to simulation without clinical verification. Secondly, terahertz waves are primarily suitable for thin sample analysis and restricting deep tissues application. Lastly, strong water absorption in tissues can attenuate terahertz signal and reduce effective sensing depth. These challenges are well recognized in Terahertz Biosensor and directly guide our ongoing work. We are actively addressing them through designing optimization, improved signal processing, and planned experimental verification. And here is the team behind the project. So here are some key reference which is based on solid foundation of previous research. Thank you.